Following the recent outbreak of Bluetongue virus, this video was set up for veterinarians to refresh your knowledge on Bluetongue disease and the effect of climate change. In September 2023, the Netherlands faced its first Bluetongue virus outbreak since 2009. The virus was first identified at several sheep and cattle farms in North Holland and Utrecht. This led to the loss of the Netherlands' Bluetongue-free status, accompanied by immediate implications, including restrictions on animal transportation. In this knowledge clip we will further address the historical context, pathophysiology, clinical signs, diagnosis, control, and lastly, the effect of climate change and conclusion. Historically, Bluetongue had sporadic occurrences in Europe, primarily in countries with suitable vector conditions such as Portugal, Spain, Cyprus, and parts of Greece. Around 1998, possibly related to climate change, various serotypes of the Bluetongue virus spread to new regions, including France, Italy, and the Balkan states. A major outbreak in 2006, following the introduction of serotype 8 in the Netherlands, led to a surge in outbreaks in 2007 and 2008. A successful vaccination program followed in 2008, reducing Bluetongue cases drastically. Afterwards, the Netherlands remained free from Bluetongue until the recent outbreak. Bluetongue is a vector-borne viral disease, caused by the non-enveloped Bluetongue virus, a member of the genus Orbovirus in the Reoviridae family. The virus is transmitted through Culicoides midges and affects ruminants. After infection, the virus spreads from the podontate to the local lymph nodes where it replicates, and then spreads through the circulation to other parts of the body, leading to various clinical manifestations, cell damage, and tissue inflammation. The virus appears to escape the neutralizing antibodies by sequester in the invaginations of the erythrocytes. Most seen clinical symptoms in sheep and goats include edema of the head, excessive salivation, fever, apathy, and inflammation of the crown edge, possibly leading to lameness. Infections in pregnant ewes can lead to abortion and congenital defects. In cattle, clinical symptoms include a sudden drop in milk production, fever, depression, excessive salivation, nasal discharge, and ulcerative dermatitis. There is no treatment available for Bluetongue. Infected animals should be supported with symptomatic therapy. Luckily, humans do not have to worry about contracting the disease, since they are not susceptible to the virus. Diagnosis is vital for control and eradication. It starts with recognizing the symptoms. Currently, the RT-PCR, AGID and the C-ELISA are the recommended testing method of the WOA in diagnosing Bluetongue for international trade. The RT-PCR is also the preferred method in screening of Bluetongue. The control of Bluetongue is essential to ensure safe international trade of animals and their products, and to prevent economic impacts because of trade restrictions. Control measures include vector control through stabling overnight, improved stable conditions such as fly netting, insecticides, and systemic administration of ivermectin. Restriction zones help reduce Bluetongue dissemination during outbreaks, but vaccination remains the most effective control method. However, most vaccines do not cover multiple Bluetongue serotypes, and after vaccination it is impossible to distinguish vaccinated animals from infected animals. It is important to remember that it is mandatory to report confirmed infections with Bluetongue virus to the NVWA. Climate change may increase the risk of Bluetongue outbreaks. Expansion in Europe has already been linked to growing midge vector ranges. Temperature affects midge populations, biting rates, and virus replication, potentially leading to more outbreaks. Bluetongue is not the only disease affected by climate change. Others include West Nile fever, epizootic hemorrhagic disease, and dengue fever. So in summary, Bluetongue is a vector-borne viral disease, which is spread by midges. In sheep it can lead to clinical signs such as edema of the head, excessive salivation, fever, apathy, and inflammation of the crown edge, possibly leading to lameness. In cattle the disease can potentially cause a drop in milk production, fever, depression, excessive salivation, nasal discharge and ulcerative dermatitis. RT-PCR, AGID and the C-ELISA are the recommended testing methods to diagnose Bluetongue. At the moment, only symptomatic treatment of infected animals is possible. Vaccination is the most effective method of control. However, there is no vaccine available for serotype 3 yet. the serotype of the current outbreak. As the recent Bluetongue outbreak in the Netherlands demonstrates, understanding and effectively controlling this disease remains crucial to safeguard animal health and international trade. The discussion that remains is whether to accept or eradicate the Bluetongue virus in our country. So, what is your opinion? Accept or eradicate?
Created using Bluetongue.